Canine lymphoma is a prevalent and complex neoplastic disease in dogs, often sharing remarkable similarities with human non-Hodgkin lymphoma in its clinical presentation, molecular biology, and response to treatment, making dogs a valuable model for comparative oncology. Its increasing incidence in dogs may reflect shared environmental risk factors with humans. While the exact cause is unknown, genetic predispositions are suspected in certain breeds, and environmental factors like exposure to household chemicals or industrial areas have been implicated. The most common form of canine lymphoma is multicentric, characterized by generalized lymph node enlargement, but extranodal forms can affect various organs such as the gastrointestinal tract, skin, or mediastinum. A significant paraneoplastic syndrome, hypercalcemia, is often associated with T-cell lymphoma. Diagnosis primarily relies on cytological examination of fine needle aspirates from affected lymph nodes, though histological biopsies are often necessary for low-grade or atypical cases and further subclassification. Immunophenotyping, which determines whether the lymphoma is of B-cell or T-cell origin using techniques like flow cytometry or immunohistochemistry, is crucial for prognosis. Flow cytometry is a sophisticated technique analyzing individual cell features and antigen expression, proving highly useful for diagnosing and prognosticating hematopoietic neoplasms, but it requires live cells and is best complemented by other diagnostic tools such as PCR for antigen receptor rearrangement, PAR. Recent transcriptomic analyses have identified upregulated HERC5 in canine lymphoma and differential expression of genes like IKZF2, CCL4, SAA1, upregulated, and CD40, downregulated, in T-cell lymphoma, which are correlated with poorer prognosis. Chemotherapy is the mainstay of treatment due to the systemic nature of the disease. CHOP-based cyclophosphamide, doxorubicin, vincristine, prednisone, multi-agent protocols are considered the standard of care, yielding high complete response rates, 85% to 95%, though most dogs eventually relapse. Glucocorticoids can induce temporary remission but may lead to chemotherapy resistance if used before other agents. T-cell lymphomas generally have inferior outcomes with CHOP-based chemotherapy compared to B-cell lymphomas, sometimes necessitating alkylator-rich protocols. Drug resistance is a major limiting factor, often linked to drug transporters. Newer FDA-approved small molecule inhibitors, such as robecfossadine and verdinexor, offer additional treatment options, particularly for relapsed or refractory cases. Immunotherapy and targeted therapies are also active areas of research to overcome current treatment limitations. Prognosis is variable, with key factors including immunophenotype, T-cell lymphomas generally having shorter remission and survival times than B-cell lymphomas, clinical stage, and response to treatment.